You're standing at the pharmacy counter, looking at two different paths. On one side, the standard options, Manforce and Vigora. On the other, the premium tier, Super Manforce. Most buyers don't realize how these pills differ at a molecular level, or the specific trade-offs involved in their price and performance. The data shows that the primary demographic for these pills isn't who you'd expect. They are overwhelmingly physically healthy young men. These users aren't usually facing a physiological failure. Instead, they're reacting to performance anxiety or a perceived lack of stamina. This flowchart maps the market. The goal of increased stamina branches into a doctor-prescribed diagnosis or a self-prescribed response to anxiety. For healthy young men, self-prescribing is default. But taking this TAF without a diagnosis risks long-term health issues. It's a heavy chemical intervention being used to address a mental barrier. To understand which option actually works, we need to analyze the specific chemical trade-offs, the efficacy, and the side effect profiles. This is an analysis of the facts, not a medical recommendation. You must consult a physician before using any of these medications. These are potent allopathic drugs. They work as vasodilators, meaning they forcefully override your body's natural vascular regulation. These chemicals are pharmaceutical tools that dictate your blood flow. They shouldn't be treated with the same casualness as a supplement or vitamin. When you treat a heavy pharmaceutical intervention like a lifestyle accessory, you risk causing lasting physiological damage. Let's start with the baseline options, Manforce 100 mg and Vigora 100 mg. These are the most accessible pills on the market, costing roughly 10 to 15 rupees each. That small investment buys a drastic surge in blood flow, maintaining an erection for 30 to 120 minutes. The mechanism behind this is extreme vasodilation, forcing the blood vessels to expand well beyond their natural state. This diagram illustrates the systemic impact. The drug creates acute blood pressure spikes that radiate upward, flooding the chest and head. Users commonly report severe headaches, blurred vision, and burning eyes as a result. This violent expansion puts the entire circulatory system under significant stress. The low price of standard pills comes with a harsh, taxing physical toll. Then there is the premium alternative, Super Manforce. Here, the price jumps significantly, usually ranging from 30 to 55 rupees per pill. The cost difference is due to a modified active ingredient formula, designed to be more selective than the standard baseline. In practice, you get the same physical results, but with a lower incidence of the pounding headaches or eye pressure seen in the cheaper options. The premium price pays for a smoother chemical experience, rather than a more powerful one. Beyond the immediate 2-hour window of the drug, we have to look at the long-term consequences of regular use. For a healthy individual, using these pills more than once or twice a month begins to move into the territory of overuse. Frequent usage rewires your psychological response. The brain starts to associate sexual performance exclusively with the presence of the chemical. This is followed by a physical decline. The body eventually loses its ability to initiate natural physiological responses without that pharmaceutical trigger. Relying on artificial confidence today risks creating a permanent natural dysfunction in the future. Finally, we must identify the specific medical conditions that make these pills an absolute hazard. This safety risk map categorizes the danger levels into 3 tiers: critical hazard, caution, and medically approved. The critical hazard zone includes anyone currently taking medication for blood pressure, blood sugar, or neurological disorders like seizures. This zone also includes anyone with a history of liver, kidney, or heart conditions. Forcing the vascular system to expand while managing these conditions can directly induce a heart attack. For those with pre-existing conditions, these pills aren't a performance aid, they are a life-threatening health risk. In terms of balancing effectiveness with fewer side effects, Super Manforce offers the most consistent results for the user. However, being the safest in a group of harsh chemicals does not mean it is safe for frequent use. If you are healthy and choose to use these, they should be strictly reserved for rare occasions. If you find yourself needing them regularly, you need to address the root cause, the psychological anxiety. Real stamina is optimized through mental health, confidence building, and physical fitness, not pharmacy shortcuts. Lasting performance comes from a healthy mind and body, not from a temporary chemical crutch.